All right, so this actually marks the beginning of our work on adrenergic drugs. So in the beginning of our work for adrenergic drugs, we'll do more of what? Looking at the classifications. All right, the different classifications of what? Adrenergic drugs. So the first one we'll be looking at is the beta 1 selective blockers. Beta 1 selective blocker types of what? Adrenergic drugs. So for this one, what we got is this. This is a beta 1 selective. So just focus on the beta 1 selective. So we'll just do surface level, knowledge on it. Then later on we'll come back and do the in-depth. So for the beta 1 selective blockers, they are also known as what? Cardioselective beta blockers. They are designed to primarily block the beta 1 adrenergic receptors, which are usually found in the heart. So this makes them especially it makes them especially useful in treating all those heart related issues like hypertension, angina, all right, all those dysregulation in how the heart is beating and all of that. All right, also heart failure, while minimizing effects on the lungs. All right, so these are the examples. All right, we are not going to talk about the in-depth pharmacology of any one of them. We're not going to talk about in-depth pharmacology of any one of them. Of course, later on we come back and talk about the real pharmacologies of each one of them. So for this, we'll just list them. Then you can be looking at the common brand names you can find these drugs under, then the key uses. So we have drugs like Metoprolol, Atenolol, Bisoprolol, Esmolol, Acebutolol, Betaxolol, Nebivolol, Landiolol. Okay, these are some of the drugs that you basically have in that class. So for what we got, so why selective matters is there's reduced risk of bronchospasms. So they selectively, all right, so they are safer for patients with what? Asthma or COPD. That's like you want to use them to treat heart related issues, so they act only where you are taking them to. If it is for eye, the ones that are meant for eye issues like glaucoma, they act only on the eye cells. So there's fewer side effects coming up, fewer metabolic side effects, targeted cardiac effects. All right, so side effects is what? Bradycardia, fatigue, dizziness, cold extremities, depression. May still affect beta 2 receptors if the dose is so high. So even when you are taking them, the dose at which you are taking them is very, very important.